Normally I wake up at 6. Then I go to work. But that day, I feel very giddy. So I go back and sleep again. 2 hours later, around 10 o'clock, I wake up. I went to see my company doctor. They do ECG, found out having a heart attack. In the ambulance, they give me first aid treatment, and when I go to the hospital, they send me for ballooning. My vessel, 3 vessel was blocked.
Heart diseases essentially is a blanket term covering diseases like coronary artery disease, heart failure, arrhythmias, and valvular heart disease. Heart failure essentially is a condition whereby the heart is unable to meet the demands of the body for oxygenated blood. It's one of the top causes of death in Singapore. Hello, Mr Sathappan.
Hi.
How are you?
I'm
Have a seat.
fine.
I haven't seen you in 6 months.
Yes.
How have you been? Any new symptoms or still okay?
No. It's
So Mr Sathappan actually was admitted to Tan Tock Seng Hospital for a heart attack. Subsequently, he was found to have a heart failure, whereby his heart scan showed that his heart was weak. Blood vessels were opened up during the episode of a heart attack, and subsequently he underwent medical treatment and also cardiac rehabilitation. So essentially what happened is we have 1 artery on the right and 2 arteries on the left. You had a blockage in the right, blockage in this artery and also this artery. So what caused you to come to hospital was this one. So we open it up for you with the balloon and stent. So now we need to prevent it from getting blocked again. So therefore just continue medicines and your lifestyle and exercise. So the diagnosis of heart failure is a combination of symptoms, history, and investigations. The red flags of symptoms that we need to be worried about, they would have shortness of breath, lower limb swelling that has occurred for quite a period of time. In terms of their medical history, they can have risk factors like diabetes, hypertension, high cholesterol, a previous heart attack. In terms of investigations, what we usually do is an echocardiogram, whereby we do an ultrasound of the heart, and that can tell us whether the heart muscle is weak or there's thickening of the heart muscle that results in a stiff heart. What is most important now is we need to continue all the medications, continue your heart-healthy lifestyle and your exercise, and then we will monitor you closely over the years. So the treatment for heart failure is mainly 2 parts. The first part is medical management, whereby we give the patient good medications that can help with the weak heart to relieve the strain on the heart and to essentially allow the heart to be stronger. The other part of management is that non-medical management essentially includes lifestyle management, including diet, including exercise. All of this helps the patient maintain a healthy weight and essentially prevent recurrence of the weak heart and accumulation of the fluid in the body.
After the incident, I have to change my lifestyle, go on diet, less salt, and only when cooked food.
Making dietary changes can reduce the strain on the heart, hence relieving some of the symptoms in heart failure. Individuals with heart failure can focus on having a low sodium diet. Having too much sodium can cause the body to retain extra fluid, causing the heart to work harder. Main sources of sodium comes from added salt, sauces and seasoning added during cooking, followed by processed foods. Ways to reduce your sodium intake includes choosing fresh foods such as fresh vegetables, poultry and eggs, which are naturally low in sodium, over processed and preserved foods like ham, sausages and pickled vegetables. Secondly, spicing up your dishes using natural flavorings like parsley, curry powder and lemongrass. This can enhance the taste of dishes while reducing the use of salt and seasoning like ketchup. Thirdly, limiting the amount of soup and gravy taken when eating out. Mr Sathappan really enjoys savoury foods, and we work together on lower sodium recipes such that he can enjoy his foods while taking care not to overwork his heart. Some tips to help one to keep to their fluid allowance include having a low sodium diet, as salty food makes you thirsty. Secondly, keeping track of the amount of water that you drink using a measured bottle or jug. Thirdly, drinking from smaller cups or rinsing your mouth often without swallowing. There are also many recipes available to provide inspiration in preparing healthy and delicious meals.
My condition was quite bad. It took some time to recover, and the medical team putting a lot of effort to overcome my problem, and I really appreciate. After this incident, I take medicine properly, control the food, and do more exercise. So these three things can help the patient to recover soon, and must be positive thinking that you can recover.
So if you have symptoms of heart failure or are concerned about your lifestyle risk factors, please consult your GP or primary care doctor so that further investigations can be conducted for you and screening can be done.